Hello, everybody, and welcome to the latest episode of the Raving Patients Podcast. As you know, I'm your host, Dr. Len Tao, living in sunny Florida, but speaking to people all over the country. Today's guest I met at the Smiles to See meeting last week. She actually had come up to me after my seminar called "Oh My God, I Got a Bad Review. What Do I Do?" And she really gave me some interesting stuff to take away with me and her thoughts on why patients leave bad reviews. So I thought she'd be the perfect person to kind of inform and introduce to the listeners of the podcast. So today's guest, is Elizabeth Dooher-Anthony. I'm going to read Elizabeth's, or Beth's as she'd like to be called, bio, and I'll have her kind of expand on her what she's currently doing and how she got involved in the space, and then we'll jump into the content part of the episode. So Beth has been a dental hygienist for over 30 years. She created her company called Serdentity to help dental professionals have better, more peaceful patient interactions. She is an orofacial myofunctional therapist practicing with PrimalAir, which is based in Wisconsin. She's a published author of a book and articles in RDH magazine, and she has created and presented 2 webinars. She's also a singer and an actress. So welcome to the Raving Patients Podcast, Elizabeth Dooher-Anthony.
Hi, I'm happy to be here.
Well, I'm glad we made this connection. I'm glad you came up to me after my session and had the wherewithal to discuss your thoughts on negative reviews. So for the people in the industry that are listening or watching that don't know who Beth is, I read your bio, which was brief. Thank you for making it brief. Mm-hmm. Sometimes I have a really long thing to read.
Oh, right.
But tell people a little bit about yourself, your background, and we'll take it from there.
Okay. First of all, anything with raving in it is it's me, like all over. So yeah, I've been a hygienist for 32 years, but my initial love is performing, and I was a theater major. I have a bachelor's degree in English with a minor in theater arts, and I pretty much became a dental hygienist by accident. I was working at Pier 1 Imports, and this really nice older man came in and bought a Charlie Chaplin poster, and he said, I was like, oh, I love that. And he said, yeah, I'm going to hang it in my office. And I said, oh, you have an office? Would you like to give me a job? And he was a dentist looking for a receptionist, and he hired me. I showed up at his office with my little briefcase and my suit, and he hired me as his receptionist. I didn't know anything. I called it a proffie. I had no idea about anything. I just knew it was an office and I had a good voice. I could answer the phone. So that is how I got into dentistry. After about 18 months of working at the desk, I realized that the patients loved the hygienist. She seemed to really love her job. I heard that she could make pretty good money, and I heard it was a 2-year program at the local community college. So, I'm 24. I can do what I want. So I went back to school and got an associate's degree in dental hygiene. So here I am 30 whatever years later, and it's been the perfect career for me.
That's really interesting that you met the dentist at Pier 1 Imports. He felt you had a good voice, which is always half the battle, is finding someone with the proper intonation, the proper voice at the front desk.
Right.
And hired you for that, and then you found your calling and became a hygienist. That's a great story, just in and of itself. Finding someone who's really good at the front desk is very hard these days.
Oh, well, it's
then it was probably
it's a whole different job now.
Oh, much different than it was. Sure.
We had a pegboard. I mean, this was back in the day. I used to one night I brought the pegboard home because I had to balance it, and I left it on the roof of my car, and it fell off in a main road and got run over by a bunch of cars, and he didn't fire me. I bring the pegboard in the next day, and there's tire tracks on some of the it's like, so anyway, why is there tire tracks on these papers? Oh, nothing. It's fine. It was on tire tracks. But he didn't fire me. I mean, he was a, God rest his soul, he was a beautiful, beautiful man.
Well, that's like I said, I think that's a great story. Great way to introduce you. So you've been doing hygiene for 30-something years. And so talk about how you transitioned to myofascial therapy and those types of things.
I heard about the Orofacial Myofunctional Therapy for the first time about 4 years ago from my best friend who's a body worker. She does cranial sacral therapy and other different kinds of body work. And she, as a matter of fact, taught me, I'm a level 1 Reiki practitioner. So I've always wanted to be more. I always want to do more for my patients than just clean their teeth. And when I heard about orofacial myofunctional therapy, where you're working with people to help them breathe better, eat better, swallow better, open their airways, and you're really improving their quality of life, I was like, heck yeah. And my friend's like, yeah, I heard people are getting like $100 an hour to do these visits on Skype. I'm like, what? So, I went to Chicago and took the 28-hour intro course. And then I also took another intro course online in the 2018 and 2019. So I've been at this for about 3 years.
And how do you compare the orofacial myofunctional therapy to your dental hygiene?
Well, even if I never saw a client for myofunctional therapy, it has made me a way better hygienist because now I understand. And all these things, when I created Serdentity, I created 20 years ago. So I knew that there was, patients who were traumatized, presented with a lot of behaviors that were really challenging. And I finally put the pieces together when I learned about the airway. I'm like, oh my God, it's their airway. If somebody can't breathe, it doesn't matter. And dental trauma happens when people can't breathe.
Gotcha. Okay, well, that's really good intro to you. And, why don't you talk briefly before we get into the content, talk about your company, Serdentity, and what you do and how you help dentists.
Okay. So Serdentity started as an overhead projector presentation in like 1996. I started talking to local dental groups about these patients that are so difficult, how to approach them and make it better so that you get a better interaction. Because what I found was, I always treated people well. But what would happen is I'm on the inside reacting to these patients' behaviors and getting really frustrated and really resentful, and then be in tears by the end of the day with frustration that these people weren't doing what I wanted them to do. And, I had good intentions. What's wrong with you people? I'm just trying to do something good for you. And so in 1995 is when it first hit me. I was working in this periodontal office, and there was a patient in the chair next to me who had been the victim of a violent crime. So she had PTSD, not only in the dental setting, but also in general. So she sat down in the chair, and she was really hypervigilant. I mean, her eyes were like this big. She's looking all around. Her voice was really loud like this. And you could just tell she was really operating out of her primitive brain. So, my coworker got her in the chair, and this girl was blonde and blue-eyed. She looked like Rebecca of Donnybrook Farm. I mean, she just was nothing threatening about her. So, when my coworker leaned her back to start to work on her, when she leaned over her, the woman absolutely panicked and leapt out of the chair and just melted down. And it was a really stressful experience for everybody. But all of a sudden, I was like, "Oh my gosh, she's reacting to somebody over her. She's not reacting to what's going on right now. She's having a post-traumatic stress flashback." And then all of a sudden, I realized that, wow, a lot of patients are reacting. They're not reacting to me personally. They're not trying to make my job harder. They are reacting based on their past experience. And that was like, wow. That right away took a huge load off of me. And I wanted to just carry the message. I wanted to let dental people know that you don't have to go home in tears at the end of a day of difficult patients, that it is possible through you increase your knowledge, that increases your empathy, and you can deal with these people and not have it ruin your day.
Perfect. So I'm excited to have you rehash what we spoke about during the few minutes we interacted at the meeting. You came up to me and said, after my class, "Oh my God, I got a bad review. What do I do?" That you have the reason why that patients leave negative reviews. So can you explain how you explained it to me? Because I was sitting at the table with one of my competitors. I told you it's from Swell, and we were chatting about reviews. And when you came up, we both listened, and we really thought it was an intriguing way to think about why patients are writing these reviews. So I'll leave the floor to you to go over this, and I'll listen intently again.
Oh my gosh. So do I even remember? Well, I'll just say what I always say. It's the patient's emotional experience of the appointment that they base their review on. So they don't care about your clinical skills. They don't care where you graduated in your class or all those plaques that you have on your wall. They don't care. People, Maya Angelou said, they're going to remember how you made them feel. So the patient judges us by how they feel when they're in our care. And patients put up bad reviews when they feel like we don't care about them. And so to me, the patient's emotional experience is the absolute most important thing. And the emotional experience begins with your airway, because if you can't breathe, you're not going to have a good time. So, if a patient's chief source of oxygen to their brain is their mouth, and I put a bunch of stuff in their mouth, and they can't breathe, their brain and their body, their tongue's going to go, heck no, out you go. And if I'm going to stand there and go, I'm trying to get this X-ray, I really need it. Or if, I'm the hygienist, I need to update your bite wings. Nope, no x-rays today. Well, Mr. Jones, the law says I have to take these x-rays. Or the doctor really wants these x-rays. Or, you need to sign this paper because I don't want to get sued for supervised neglect. Not that we say that to our patients, of course, but what Mr. Jones knows is that bite wings are horrible. He's got huge tori and a strong gag reflex, and he doesn't care. So is that generally along the lines of what I was running my mouth?
Yeah, you had said that it had to do with the lack of oxygen in the airway issue. I was waiting for you to get to that part because that was the issue. So no, you got to it eventually. Was that they're having airway issues and breathing issues, so they relate that, and that's why they're really coming out of the appointment with a bad experience, and they're going online and writing these bad reviews.
Yep.
So that is what you told me. I thought it was a very interesting take on things. Mm-hmm. So I'm glad you were able to rehash most of it when we kind of recorded it, rather than just chatting at the meeting together.
I wouldn't really call it a chat. I was pretty much talking at you.
Well, you told me you liked my seminar.
I
you told
did.
me about yeah. So I mean, you can talk at me. People do it all the time.
Right.
So so let's talk about why these. And I know you touched on it in a very general sense here, but how do negative patient interactions occur? Now, obviously, it's more so than just airway issues. There's a lot of different things in a practice that can cause negative patient interactions to occur. So I'll let you, again, the floor is yours on this. I'm going to listen intently.
So again, it's the patient's emotional experience of the whole thing, of the atmosphere. And like was said by yourself and many other speakers, it starts from the moment the patient walks in. If a patient has been traumatized, though, they're going to perceive the dental setting differently than somebody who hasn't been traumatized. So when a patient comes in and they're acting out of their primitive brain, they're looking around. What they're seeing isn't what we're seeing. So what happens is a lot of times patients who are fearful can have these presenting behaviors that can be, provocative, especially if a patient is presenting as hostile, argumentative, defensive, or if they're presenting as hysterical, oh my gosh, overreacting to everything. This can be extremely stressful to the dental person. So what happens is the dental, whoever it is, whether it's behind the desk, the hygienist, the assistant, or the doctor, reacts to these presenting behaviors, and then it just spirals down. Especially when you have a patient who, I have to. If you have a type A patient that's presenting as hostile and you say, I have to, that's just not happening. And so it becomes a power struggle. And then once you have a power struggle, then it really gets into, murky waters, and it just doesn't go well. So to me, that's the basis for bad reviews, is because there's been a misunderstanding, which starts, right off the bat.
Gotcha. Okay. All right. I think that's all good information. So tell me and tell the listeners again where or how or what creates dental trauma in your mind, because the trauma is going to lead to them really having a poor experience, writing something online about the practice, maybe not returning to the practice. That's the worst thing something can happen is them not coming back to the office anymore.
Mm-hmm. Yeah, and I've seen patients like character assassinate providers in reviews, and it's terribly frightening for the provider, because the patient is only presenting their side, and like you said in your thing, it's better to just bury the bad review with good reviews than to try to rebut the patient in the public forum. Dental trauma starts with the airway, always. And whether it's, whether it happened in childhood, it's usually in childhood. So somebody goes to the dentist and they're a mouth breather, and the dental people are trying to get something done in this person's mouth, and it's not happening. And the dental people react with anger and judgment, and they shame this person. So this person has not only been perhaps physically harmed, definitely emotionally harmed, and they are ashamed. So they come to associate pain and shame with the dental office. So every time they come to the dental office, they walk in and there's that smell. The olfactory nerve gets your memory center going. Remember back in the day when offices used to smell like cloves? It's not so much anymore, but the eugenol, man, everybody, I would wave a little clove oil underneath somebody's nose and be like, oh, the dental office, the dental office. The olfactory nerve is very much linked to your memory center. So So every time the patient presents in the dental setting, they're re-traumatized. And what happens is, just like with post-traumatic stress disorder, you have avoidance. They just avoid the dentist. They don't go. And they wait, they don't go, then they have pain. Then they have so much pain that they can't not go. The only thing stronger than fear is pain. So the patient shows up at another dental office hoping it's going to be different, and they may, they get them out of pain. But as soon as that patient gets in the chair, it's the same old thing. I can't breathe. They're stuffing a bunch of stuff in my mouth. So, you've seen it 1,000 million times. Patient comes in, you do an extraction, you do a pulpotomy, you start a root canal, you get them over to the hygienist for a cleaning, and they may come back, they may not. But so, it's just a merry-go-round. I've actually seen patients in 2 different practices that I was working in. The same patient in 2 different practices.
Gotcha. Okay. And then what recommendations do you have or have you made for what you had written down was solutions for better patient interactions? But how do we interact with patients better? Do you have any suggestions there? Do you have like a number of tips you can give when it comes to those patient interactions?
Absolutely. The most important thing is to remember I am in control of my reaction. I'm in control of what comes out of my mouth. Nobody can make me feel or say anything. And if I can stay calm, I have to approach that patient with as non-judgmental an attitude as I possibly can muster. Even if I've had experiences with them in the past where it's like, it happens, you're like, oh God. You see so-and-so's name, it's like, So I've had to, sit in my room and say the Serenity prayer, which is how I got the word Serdentity, is serene in dentistry. So this, sit in my room and literally say the Serenity prayer over and over, like 2 or 3 times, to calm myself down so that I can go out to the waiting room and open the door. Hi, how you doing? And they're like, I hate it here. And just let it roll off and get them to the back. So that's the most important thing. The next most important thing is to acknowledge to the patient that that they've had bad experiences. Especially for like the first time seeing somebody, if I'm looking at their previous x-rays and they can't close, the posterior images are all blurry, that like right away is a red flag. Okay, this person probably has doesn't like x-rays, has is a mouth breather. And when I get the patient in the chair, 99 times out of 100, they sit down and I look at them and they're breathing like this. Their lips are dry and cracked. And I look in their mouth, and they have huge tori. And their tongue looks like it fills up their entire oral cavity. So I look them in the eye and say, hey, I'll bet you don't like dental x-rays, do you? And they're like, no, I don't. I'm like, you know what? I can see why. That right there is like magic. So, acknowledging to the patient that, that it's okay that they've had bad experiences, but, the experience today is not going to be bad.
So one of the things I wanted to ask you real quick was that you actually you should recognize to the patient, or you should acknowledge that the patient actually had a bad experience.
Yes. You can either ask questions and get the answer, or, if a person's acting really, really frightened, and look in their chart too. If it says gagger all over the chart, that's a pretty good indication that patient has had problems in the dental chair, has been, and a lot of patients will sit down, look at their body language. Are they white knuckling the chair? Do they have one foot on the floor? These are ways we can the things, observations we can use to let ourselves know that, okay, this person, I need to approach them very calmly.
Okay. All right. Sorry, I interrupted you. Go
Oh,
through
no,
the
that's
other
okay.
other ones that you were talking about. We were talking about solutions for
So,
better patient interactions.
yep. So, keep myself as calm as possible. Acknowledge to the patient that you're going to take good care of them, and keep the patient's airway open as possible. If somebody's a mouth breather, and also, rather than interpreting these the gag reflex, freaking sitting up, rinsing and spitting, these are all protective mechanisms for people to keep their airway clear. So rather than getting annoyed and feeling sorry for myself that this jerk isn't, I'm trying to do something here and they're not letting me do that, I can just tell myself, okay, they're protecting their airway. And if you have a good assistant who can keep the back of the throat from collecting liquid without gagging the patient, that assistant is worth $1 million.
Yeah, that's really important. You mentioned making sure that they have good suction and they are very good at getting the stuff out of their throat. I have many patients who, if they have a drop of anything in their mouth, they freak out.
Right.
So I can understand why that's really important as well.
Because they're mouth breathers, and this airway protection is the basis of these behaviors. And oral reflexes also. I figured this out more from my nursing home patients because of dementia. Their oral reflexes have returned. Like this, the pucker. Like as soon as I touch the mouth. And that's really hard to work around. But a lot of normal people have over-retained oral reflexes, and I think it has a lot to do with their airway as well. So when you have a patient who's those are all to protect their airway. So the clearer you can keep the airway, the less of that muscle activity you're going to have. But I'm sure you've had the experience of these patients where I call it the lip and tongue tango. You get the lip down, the tongue comes out. You get the tongue down, the lip comes up. Din, 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 din. So, and that is all to protect the airway. So keeping the patient's airway clear. Extra measures like, I don't know, if you have nitrous in your oxide, a little oxygen cannula, because their brain wants oxygen. That's really the bottom line. Ozonated oils you can put on a Q-tip and put in their nose. The brain wants oxygen. If you can address that, I think a lot of the patient's behaviors will come down. But again, it ultimately comes down to me deciding that I am not going to react.
Interesting. A lot of that stuff makes sense when you think about it in the way you're presenting it. Otherwise, you wonder why patients are acting a certain way in the chair. And like I said, now you've kind of connected some of those dots, so it makes a lot more sense than it did before. So I know that I told you that I like to do a section called Would You Rather. So before we go into that section, when it kind of ends the content, was there anything else that you wanted to let the listeners or the viewers know before we end the content part of the podcast?
Yes, I do want to tell a story about when I was on the receiving end of a bad review. I was working in a very busy dental practice, and a mother and daughter came in. And in as non-judgmental a way as I can say, these are the kind of people that go on the Maury Povich show to find out who's the father of their child. So it was a mother and daughter. The mother was in with my friend in this room, and I had the daughter with me. The daughter had not had any dental care in a long time, and her mouth was, she had heavy calculus, super inflamed tissues, and the mother had said, she really had to drag her in because she hates this. So, I was able to get the x-rays on her, got her back in the chair, and and was starting to get some work done. And she was just super fidgety, reactive. And I'm trying my best to not, to practice what I preach, right? So she had so much calculus, and I was just trying to get some out from underneath her tissues. She grabbed my hands. And, I said, put your hands down. And I said it just like that. And then it was over. Then she sits up, she's crying, and then she hit her cell phone, and I was like, oh great, now she's going to take out her cell phone and start recording me. But so I was able to calm her down a little bit, and we finished up the appointment, but I could tell that she was that it was I had crossed a line. So, and I even apologized. I said, look, I know my voice sounded really stern. I'm sorry. Let's just get through this. So we get out, and her mom's, she comes running out, crying to her mother, and the mother yelled at me in the waiting room in front of a whole bunch of people. And she was a large woman, and I was afraid. I was scared. And when I get nervous and flustered, I turn really red, and my ears turn really red. So, not only was I frightened, I was mortified. And so, it happens. It happens. Even somebody like myself who goes to great lengths to avoid those sorts of things, they do happen. And I was, oh my gosh, I was just so beside myself with regret over what happened, and oh my gosh, I'm now am I going to get in trouble, blah, blah, blah. She's going to leave a bad review. And fortunately, the dentist that I was working for was supportive of me. Said, look, if somebody's grabbing your hands with instruments, you can't, that's not okay. So it was just to let you know, it happens. Sometimes it just happens.
Yeah, I always say that you're not in dental practice long enough if you haven't got a bad review.
Right.
Just like you haven't done enough root canals if you haven't broken a file. I mean, stuff happens.
Right.
I'm so, look, I brought in a lot of bad reviews because of my mouth. But there's a lot of reasons. There's a lot of reasons why patients leave bad reviews, and if you don't sweat the small stuff, as I always like to say, is don't sweat the small stuff when it comes to a bad review. Just get more positives. That's the way I look at it.
I absolutely agree.
Perfect. Well, this was a very enlightening conversation. Thank you for taking part in it. I want to now pull out the deck of cards called Would You Rather.
Yay.
And we're going to, what I will tell you, and I didn't tell you this beforehand, is nothing inappropriate.
Oh, sure.
So there's a couple of questions in here that are not appropriate for this type of podcast, but I'm going to skip over those if we happen to get one.
Certainly.
I actually ask 11. One is a standard question I ask on all of them. It's the last question I'm going to save it for.
All right.
But I'm going to shuffle the deck up, and we'll see what your answers are. Okay. Would you rather your voice sound like Elmo or Kermit the Frog?
Elmo.
He's
so sweet.
Would you rather blow your nose with sandpaper or use bubble wrap instead of toilet paper?
Wow. I'll go with the bubble wrap.
Why bubble wrap over sandpaper?
It's not so scratchy.
Okay. But if you use bubble wrap, it makes a lot of noise, like popping noises. So people are going to know you're doing something.
Well, it depends on how aggressive you are. I mean, come on.
Would you rather abolish war or find a cure for every type of cancer?
I would rather abolish war.
Okay. Would you rather put ketchup or ranch dressing on everything you eat?
I loathe ketchup. I will not use it for anything ever, so therefore we will go with the ranch.
Okay, just by a matter of default.
Right.
You don't like ketchup. Would you rather never celebrate your birthday again or never drink alcohol again?
Well, I have been sober for 24 years, so I guess I already answered that then.
Yeah, you already answered that question. And I forgot that, even though you mentioned that to me. So that's an obvious answer there.
Right.
Would you rather be single for a year, which includes no dating, or go on bad dates for a year straight? So no dating or bad dates for a year, basically.
No dating. No dating.
No dating. Okay. Here's another food question. Would you rather have creamy or chunky peanut butter?
Creamy.
Creamy. You're not a chunky person,
No,
huh?
my husband likes chunky.
Okay. All right. I don't like that question. No, that's another food question. This one is a popular one. Would you rather spend the night in a dirty dumpster or a dirty porta potty?
Oh my gosh. Probably the dumpster has a slightly better chance of not having as much E. coli.
But a smell. That's the other thing. You talked about olfactory.
Right,
that's
right.
definitely gonna hurt the olfactory
Oh God, right?
part of the body.
Oh God, that would be horrible either way.
Yeah, that's not a good question there. Okay. Would you rather work with dead people in a mortuary or work in the busiest ER trauma unit in the world?
Well, dead people are a lot more cooperative, right? I mean, except for the rigor mortis thing. There's something.
Correct.
I guess I would rather work with the dead people. There's something super sacred about when people transition from this life to the next.
Okay. All right. That's good. That's a good way of stating it. And then there's one more. And then there's, would you rather have your face printed on money or your own small town named in your honor?
Ooh. A small town named in my honor.
Okay. That's a good one. So the one I like to ask everybody, because I think I'm a tech guy, so it's pretty cool. Would you rather never be able to use search engines again or never use smartphone apps again?
Probably never use smartphone apps because I don't use that many yet. I'm still kind of behind. I still Google everything, and I don't have that many apps on my phone. So that's kind of an easy one for me, actually.
That's an easy one for you. So, okay, perfect. Hope you enjoyed that. That was, thank you for taking part.
It was fun. Thank you.
I think it's enough to be said to be able to get a different perspective on the listener, on the guest of the podcast.
Right.
So, as we wrap up the show, if people have any questions or want to get in touch with you, learn more about what you can do for them, what is the best way? What are the ways that people can reach out to you?
Serdentity.com is my website. There's also a Facebook page, Serdentity, Serdentity. If you Google search Serdentity, I'm the only that's all you're going to get. I have a book, and all my contact information is in there. Dentadiva@yahoo.com is my email.
Dentadiva, DENTA diva @gmail.com. That's correct. Okay. Before I do my wrap, anything else you want to mention to the listeners or viewers?
You know what? Dentistry can be stressful, and some days it really is, but it doesn't have. You don't have to burn yourself out.
That's a good way to end what you had said on there. So I want to thank you for joining me.
Absolutely.
I want to thank you for being a guest and sharing some of your thoughts and ideas on the various topics we discussed. For the listeners and viewers, if you like this episode, please share it. Please subscribe. Please tell everybody about it. Our episodes come out on Friday at 1 p.m. And like our Facebook page. Share the love, as I like to say. So, Beth, thank you so much again for joining me today.
Absolutely.
And as the listeners who are usually on there know that I like to, and this was very relevant for this one, I always like to end my episodes by 2 words: remember, Your reputation matters. Until the next episode, thanks, guys, for listening, and have a great day. Thanks, Beth, for being the guest.
You're welcome.